factors include the social organization of the family. What is the family structure? Is it a mother-led family? Is it a father-led family? Is it the role of the father or father figure in the family to make the decisions? And if so, is that person being included? Are there two mothers? Are there two fathers? Is it multi-generational? Is the grandparent or aunts and uncles raising the children if you're involved with children as your patients? You really need to understand the social organization and the dynamics so that you can address people appropriately and include all the appropriate people in the decision making with regard to the patient. That becomes important. If it's more than just a patient and the patient is not a minor, you do need to be aware of issues of confidentiality and making sure that you have permission with the patient with regard to confidentiality and who may need to be involved in this decision-making process of the family structure. Traditional versus cultural practices. Is someone involved in homeopathy, traditional medicine? Are they involved in cultural or folk healers such as curanderos or santerias in the community that you want to get involved with? Someone may be using herbal medicines. And if so, we know that there can be an interaction between what it is that you want to do with the patient and what it is that the patient is taking. If the patient is using an herbal medicine that may have an increased effect of heart rate or blood pressure, and you're getting ready to engage in very vigorous exercise activity, could that potentially be contraindicated for the patient? So you'll want to know about those types of things so that you don't have a contraindication. If you're using a medicine and you want to do iontophoresis or phonophoresis, so you're going to use a medicine with that patient and they're already putting on some type of cream on their body to treat it, and there's an interaction between the medicine that you want to use and the medicine that the patient is using, and they don't tell you about it, so now you have a reaction. That could be problematic. So you really need to try to find out what it is that the patient is doing. I'll give you an example. I had a patient, an international student who happened to be from China. We treated her for neck and back pain. She got, was better, and it was a wonderful thing. And so when she injured herself again playing tennis, she decided to come back to see us again. Well, on her arm, she had these huge round circles, very dark marks. They look like bruises, very, very bad bruises, but they were the same size and circular. I spent more time trying to figure out how in the world she bruised herself. Had I known what I know today about cupping as a treatment that is used as a part of Chinese medicine, I would have recognized that those bruises were actually marks from a cupping set that she had been using to try to treat her injury, and it was not successful for her, so she came back to see us. So she was using a traditional technique of her homeland, and at that time I was clueless about what it was I was looking at. Now I know, and would certainly ask appropriate questions to ascertain what's going on. Spiritual and religious practices you also need to take into consideration for your patient and whether or not there are issues there. For example, someone who is practicing Islam may be engaged in Ramadan, which is a fasting time. It is a special, very special, holy time of year for individuals who practice Islam. And with fasting, there certainly will be issues, particularly in sports where they may be restricting food anyway, such as wrestling. And so if Ramadan is occurring during part of the wrestling season, you don't want to wait until someone is injured to find out what you need to do for that particular patient. You want to know beforehand what the issues are, what the concerns are, what you can and cannot do so that you don't break with the fast in order to treat the patient. So you want that information beforehand so that you can treat the patient appropriately. And then lastly, health issues and health disparities. Are there particular types of injuries or illnesses that are pertinent to the population where you live and where you practice? If so, those are things that you need to know about. As athletic trainers, we're more than just, quote, athletic trainers. We're part of the healthcare team. And in some of our athletic training rooms, particularly those places in more rural places, we're the only healthcare provider short of the school nurse in the immediate vicinity. So you become more than just the athletic trainer. You are indeed the healthcare professional. And it's incumbent upon us to make sure we understand what are the health issues, what are the health disparities in the populations that we treat. For example, amongst African Americans with asthma, African Americans are more likely to not receive the treatment that they need for asthma are more likely to be hospitalized and are more likely to die from asthma. And so, if you're not familiar with that and you have an asthmatic patient who happens to be African American and may not be familiar with the issues that could arise, then that could be problematic. So this is an opportunity to be on the forefront of what may be happening in your community and help as a part of the issues that are going on in the community. And then lastly, stigmatization of certain illnesses. For example, mental health issues in Chinese culture sometimes, and in some African American communities, as we think about mental health, is to talk about that is taboo, and to see someone or have someone to be treated. They may go to the church or to clergy, or may not want to talk about it at all, but you recognize it as a healthcare provider that something is going on and need to find a way to have those tough discussions. Lastly, as we talk about taking an oral history, you have to elicit information. I've talked a little bit about the cultural issues that you might see, but you still have to gather the information. You still have to elicit the information. How can you do that? And I like the idea of thinking globally but acting locally. Thinking globally but acting locally. And what do I mean by that? Understanding your patient's worldview. Who are they? Where do they come from? What is their perspective? How is the patient experiencing his or her illness or injury? What does it mean to them? Understanding that there's more variation within a cultural group than across cultural groups. Kapina Bakote talks about that in her book. And that culture may not be relevant to the problem at all. It may not be. You certainly have to think about it, but you have to take into consideration that it may not be an issue. The patient may not want to share their issues from a cultural perspective, and that too is okay. So, what do you do to elicit information? Kleiman and Benson give us a nice idea of several steps that we can take to think about the cultural aspect of finding out what's going on with our patients. And there's 6 steps to their revised cultural formulation. And the first step is ethnic identity. And in this, we talk about what is the patient's ethnic identity, actually asking them and finding out whether or not it's relevant. Again, it may not be relevant to what it is that is going on, and you need to know that. We'd rather ask than to make assumptions about people's ethnic identity, therefore we avoid stereotyping them. Secondly, finding out what's at stake for that patient and asking them, how does this injury or illness impact you? How does it impact your family? How does it impact the team? If this person is the breadwinner in the family and having a torn ACL injury or reconstructed knee and they're going to be out of work for a period of time, if that impacts their ability to earn an income, then their having that surgery is indeed an issue, and the livelihood of the family is at stake. So it impacts the decisions that you may need to make with regard to designing their rehabilitation, whether or not they're coming in to see you, what they're doing in terms of home exercise program, and so that they can minimize the loss of time at work. So finding out what's at stake is important. Number 3, step 3, the illness or injury narrative, or the explanatory model. This is where the patient explains what is going on. When there is illness or when there is injury, someone is telling a story about what took place, why it took place, or how. And so it's important to let them tell the story in their own words and to listen to that. Step 4 is psychosocial stresses. Are there psychosocial stresses associated with them being injured or ill? Are there issues associated with the family? Does their injury or illness put an undue stress on the family and therefore the patient becomes stressed about it? Does the injury or illness affect the team, or is the patient made to feel that the team is being let down? Are there work stresses? Again, if your patient is someone who is in the workforce, are there issues there that provide stress? And if so, what are we doing to address those social and stress issues? Might that person need counseling associated with their rehabilitation, and you need to refer them to another healthcare professional to deal with the stressful aspect of dealing with their injury? Or if it's a game-ending, season-ending type of loss, maybe that individual is having a difficult time in dealing with the fact that they're no longer going to be able to participate. Or even if it's a career-ending type of injury, may have difficulties with the stresses associated with that. So we may need to bring in another member of the healthcare team. Step 5, determining the influence of culture on the clinical relationship that you have with your patient. Again, as I mentioned earlier, culture is indeed present. Now, whether or not it's relevant to what's going on is a different issue, but nonetheless, it is present. It's including the medical culture. We don't think about the culture of the athletic training room or the culture of medicine. The use of technologies, how invasive it can be to do certain types of medical procedures, and whether or not people want their bodies invaded in that kind of way. So it's not just culture in terms of race and class and sexual orientation or religion, but medical culture has to be taken into consideration, and whether or not that individual wants to be poked and prodded in ways that we may think as healthcare providers is what should take place for that individual, but that individual may not want those types of technological procedures done. And then lastly, recognizing the problems of the cultural competency approach. We have to think about the efficacy of the treatment. Is what we're doing going to work? Does it have cultural connotations? Do we need to take into consideration the culture of the patient and what they're doing? What are the unwanted side effects or the unintentioned side effects of focusing on cultural differences? For some individuals, they may already feel that they stand out because of their culture or their race or their religion or their sexual orientation, and may not want more attention brought to them because of those issues. They may not want to have that addressed. So there could be an issue that we're trying to be culturally competent and culturally appropriate, but that individual is trying to shy away from that particular aspect and not want that to be a focus. They may feel that they're singled out. They may feel that they're being stigmatized in some way, shape, or fashion. So again, you need to consider that as well from the patient and try to minimize the patient feeling in that way. And Kleiman and Benson suggest, as a part of the explanatory model, when we go back to our step number 3, when we do the narrative, these are the types of questions that are listed before you that you may want to ask. What do you call the problem? Now, for many athletic injuries, they'll come in and say, I call it an ankle sprain. But if it's illness, they may call it something else with regard to that. What do you believe is the cause of the problem? Now, for some individuals, it was because I didn't condition. I was running down the track and I sprained my ankle. For someone else, they may say, I didn't do the right thing. I was a bad person, and God is punishing me. And this is the way that God is punishing me, because God knows that I really, really like and need to participate in this particular sport, and this injury will prevent me from doing so, and I was a bad person, so God is punishing me. And if the person believes that, then just fixing the ankle is not enough. Referring that person to someone who can handle their God issues or their issues associated with religion or spirituality may be important, again, to bring that person in as a part of the healthcare team. What course do you expect the problem to take? And how serious is the problem? So you want their perspective. If they think this injury or this illness is going to go a certain way, if they think it's not as serious at all, or they think it's more serious than it actually is, this is your opportunity to have some conversation about the severity of the injury and hopefully to put into perspective or help them to understand how serious it is or isn't, and give some realistic feedback, but also hear this from the patient's perspective. Another question, what do you think the problem does inside your body? This is probably more true with illness than it is with injury. So if someone has sustained some type of illness that you're helping to deal with, they may again internalize that this is what is going on, and it has something to do with outside world and has nothing to do with my physicalness, but has something to do with my spiritualness and what I'm not doing. And that's how this problem or the illness is infecting my body. Another question that they suggest you ask, what do you most fear about the condition? What do you most fear about the condition or about the problem? So finding out what the person's fears are very, very important. What do you think the problem, what kind of treatment do you think you should receive? So getting their input about what should take place in order to help them to heal. becomes important. What are the most important results you hope to receive from the treatment? So finding out again, what type of treatment do they think is important? Again, some patients may not have a clue, may not care to even have the discussion, but it's important to offer